AIPGET 2018. Question number 1. Muscles forming boundaries of digastric triangle, all except. So now let's see the options: anterior belly of digastric, posterior belly of digastric, and stylohavoid. Last option is sternocleidomastoid. So the answer will be sternocleidomastoid, which is not the boundaries of digastric triangle. Next, which of the following area is known as the dangerous area of the scalp? Correct answer is loose areolar tissue. Next, a person was unable to close his right eye. There is a dribbling of saliva from the right angle of his mouth and is unable to make a pout. The probable diagnosis is. So correct answer will be the Bell's palsy, because this is a paralysis of facial muscles and symptoms are face becomes asymmetrical and is drawn up to normal side and affected side is motionless. Wrinkles appear from the forehead, eye cannot be closed, and food accumulate between the teeth and the cheek. Inability to blow a whistle or make a pout, dribbling of saliva. Correct answer is Bell's palsy. Radiographic Santon's line is observed in respect of which joint? So what is Santon's line? It is a curved line seen in radiograph of normal hip joint, and it is used to determine the relation between the head of the femur and the acetabulum. So answer is the hip joint. Next, ketone bodies are utilized by all tissues except. So ketone bodies are utilized by muscles, heart, kidney except liver. यहाँ पे ये प्रोड्यूस होता है एंड बाकी मसल्स एंड हार्ट, किडनी द्वारा इसका कीटोन बॉडीज़ का यूटिलाइज किया जाता है. Next, the most abundant protein in the body is collagen. Next, which of the following is the most universally accepted and sensitive indicator of the whole population and the socio-economic condition under which they live? Answer is infant mortality rate. Next, which of the following characteristics should be considered most important while applying screening test in disease like cancer? Answer will be the specificity. What is the difference between sensitivity and specificity? Sensitivity is the test to identify the patient with a disease, and specificity is the test to identify the patient without disease. Next question, which one among the following is not considered as millet? What is millet? Millet is a small seeded cereals like that is jawar, bajra, ragi. So answer will be the maize. This is not millet. Out of the following, which is the most ideal time for insertion of intrauterine contraceptive device? Correct answer is post-perpural, that is 6 to 8 weeks after delivery. The most reliable method of identifying of a person is. Options given are Galton's method, Gustafson method, anthropometry and scars. All given options are the method of identification, but the most reliable is the Galton's method, which is based on the study of fingerprinting. And we can see another option also. Gustafson's method is based on the aging and decaying changes of the teeth of age from teeth in elderly person. Next is the anthropometry, which is a scientific study of measurement and proportion of human body. Next question, flaying is seen in which type of laceration? So we should know the flaying meaning is skin is removed from the body. So options given is a split, avulsion, tear and stretch. So flaying is seen in avulsion, in which a gross damage or crushing of muscles and such lacerations are caused in road traffic accident. In a split, hard blunt instruments are used. In tear, pointed end of weapon is used. In a stretch laceration, overstretching of skin and subcutaneous tissue may cause laceration with flapping of the skin, not flaying. Okay. Next, absence of pain where it could be expected is noticeable feature of Answer is the Antim crude, which is given in Borix Materia Medica. Next question, cool sweat on the face, especially around the mouth and nose, is a feature of rheum. This is also given in the Borix Materia Medica. Next, a patient complains of beating of pulses throughout the body, especially in the right. The remedy indicated for the patient is Veratriprid. To J.T. Kent, which remedy is especially indicated in those persons who manifest momentary fleeting inquisitiveness, jumping from one subject to another? And this line is given in Ambragracia and the book Lectures on Homeopathic Materia Medica written by J.T. Kent. Next question, cannot bear to be touched starts when touched ever so lightly, especially on the feet. And this line is given under Kalikar in Allen's keynote. Next question, in a patient suffering from arcus senilis, which chapter of Kent's repertory needs to be referred to find medicine superficially covering this pathology? Is found under chapter I and under rubric opacity of cornea. Next question, which of the following concept is a fundamental basis of Boni Hussein's therapeutic pocketbook? Answer is doctrine of analogy. Next, wrap up in fur in summer is found in which chapter of Kent's remedy? So we can see under rubric fur, wraps up in summer, and single medicine is given, that is Hyos. Next, match the following medicines with the time of aggravation of heat stage in fever given in Kent's repertory. So, Chamomilla 9 am, Bryennia 9 pm and Helleborus 4 to 8 pm. Next, the only remedy for rubric bleaching in mind section of BBCR is the remedy given, single remedy given is stramonium. Next, no flatters omitted upward or downward, especially after abdominal operation. And this line given under medicine Raphanus in Borix Materia Medica. Again, match the list 1 with list 2, that is remedy and inimical. So, Silesia is inimical to Muxol. In Boric, it is written Muxol and Silesia do not follow each other. Staphysagra inimical to Ranunculus bulbus. Chamomilla, Ginkgo met and Arum triphyllum is inimical to Caladium, which is also given in Borix Materia Medica. Next, afraid of sharp pointed things, pins, needle is Spizalia. Stitches in throat flying to the ear on swallowing, especially left, Staphysagra. Feeling as if heart leapt into the throat, Phytolacca. Sexual desire completely restored in females is given in Anosmodium, and all the above lines are given in Borix Materia Medica.